Okay.
Good evening to everybody. Today we are going to present reproductive system. This is my group mate. My name is Rihanna. And my name is Marini.
And my name is Muhammad Ali.
Okay, now we will go on to the sexual reproduction. I will explain how male reproductive system producing and storing and deliver the sperm. Firstly, the testicle, which is located inside the scrotum, and then this is where the sperm is produced and hormone testosterone being produced too. After that, moving to the epididymis. After the sperm is being produced, it moves to the epididymis where it matures and stored for about 2 to 4 weeks. After that, from the epididymis, sperm travel through the vas deferens through a tube, and it acts like a pathway carrying sperm towards the reproductive glands. And this is the seminal vesicle, which produces a fluid that mixes with sperm, and the fluid provides energy for sperm to move. And then moving to the prostate glands, which is right here, it adds more fluids to protect and nourish the sperm. Together, these fluids and sperm will form a semen. And then it will and this is the ejaculatory duct, which transports semen into the urethra. And then right down here is the tube that carries the semen out of the body through the penis. And not to mention, it also carries urine, however not at the same time. As you can see, there are also a rectum and bladder, but they are not part of the reproductive system. They're just located nearby. So to make it simple, male reproductive system produces sperm, nourish it, delivers it, and deliver it outside the body for reproduction.
This is a female reproductive organ, as you can see. This part is external. This is external part, and this is internal part. This is external part. This is labia majora, and this is labia minora, hymen, vaginal opening, urethral opening, and clitoris and mons pubis. So for labia majora is enclose and protect the other external reproductive organs during puberty. Hair growth occurs on the skin of the labia majora, which also contain sweat and oil certain glands. So this is labia majora. For labia minora, can have a variety of size and shapes. They lie just inside your labia majora, this, and surround the opening to your vagina, the canal that joins the lower part of your uterus to the outside of your body, and urethra, the tube that carries pee from your bladder to the outside of your body. This skin is very delicate and can become easily irritated and swollen. And hymenia is a piece of tissue covering or surrounding parts of your vaginal opening. It's formed during development and present during birth. And this is internal part, which is have fallopian tube, ovary, uterus, cervix, and vagina. For vagina, muscular canal that join the cervix, the lower part of uterus, can within the accumulates a baby during delivery and shrink back to put something nearer like a template. For cervix, a hole in the middle allows sperms to enter and menstrual blood to exit. cervix opens, dilates to allow the baby to come out during a vaginal childbirth. So dekat area sini lah yang kalau perempuan bersalin. So dekat sini. For uterus, ni it's pear-shaped organ that holds a fetus during pregnancy. So bila perempuan mengandung, baby dia akan duduk dekat sini. Ramai orang fikir dekat perut. Actually no, dia dekat area sini. So uterus is divided into two parts, the cervix and the corpus. For ovaries located on the either side of uterus, here, ovaries produce eggs and hormones. And then fallopian tubes that are attached to the upper parts of uterus and serve as a pathway for ovule to travel from ovaries to uterus. So macam eggs tu dia akan travel masuk kat sini. So lelaki punya things dia akan masuk, so dia akan pergi dekat area sini. And then baby tu akan jadi dekat area sini juga.
So I will explain about sperm or spermatozoa. What is sperm? Sperm is cells or spermatozoa, microscopic tadpole-shaped male reproductive cells. It consists of condensed DNA, protein, and microglia. For eggs or ovum, human eggs. What is ovum? A human female egg or ovum is one of the largest cells in a human body, specifically designed to contain all the necessary components for early embryo to develop. It is made out of genetic material, a protective material rich, copletism, and multiple specialized outer layer. So, when two of these combine, it is called, the process is called meiosis and mitosis.
Okay, so next is the fertilization and development. But first we look at fertilization. Fertilization is the process of a process that involves the merging of a maternal developed egg nucleus with a paternal sperm nucleus to generate the main nucleus of an embryo. Let's look at the video that I've been provided here.
While you release only a single egg each month, your partner releases millions of sperm in a single ejaculation, all with an eye on that single prize. But only one of those sperm will be crowned the victor. As soon as one lucky sperm cell succeeds in penetrating the egg immediately undergoes a chemical reaction that prevents other sperm cells from following suit. Then, the chromosomes carried by the sperm and egg come together, and the egg is officially fertilized. The fertilized egg then begins a rapid descent to the uterus. Over the next 7 days, the human embryo undergoes multiple cell divisions in a process called mitosis. At the end of this transition period, the embryo becomes a mass of very organized cells, called a blastocyst. Once the embryo reaches the blastocyst stage, approximately 5 to 6 days after fertilization, it breaks out of its protective covering and begins the process of implantation in the uterus. To find out how your baby grows and develops each month, please watch my next video.
So basically, fertilization shows that when women ovulate, and then when they are doing the intercourse, when they are doing the sexual intercourse, sperm will enter the female reproductive tract, and 1 in a million of sperm will penetrate the egg and will eventually form the zygote, which is 23 from both gender will make one complete set of 46 chromosomes. And then for development of embryo of baby, for the first trimester, for the first trimester, the baby, the fertilization happened first, and then the major organ starts to be formed, which is the brain, heart, and spinal cords. And then by week 5 to 6, the baby heartbeat started to beat, and by the end of the first trimester, the embryo, we call it as fetus. Moving to the second trimester, the fetus will grow rapidly, and bones and muscle will start to develop and harden. After that, fingers, toes, and facial features starts to become more defined, and the mother may also feel the baby's movement, and the baby at the same time can hear sounds. And then the third trimester, which is where the baby's lungs and brain continues to mature, and they also will experience increased fat and eventually gain weight, and they will also turn into a head down position for preparation of birth. So after about 40 weeks of development, when the fetus is fully developed, it is ready to be born. Moving to the reproductive organ disease, first we have uterine fibroids, which that forms in the uterus and is made up of muscle and connective tissue from the uterine wall. It is a non-cancerous disease but can cause infertility. So the symptoms are full of bloating, painful bleeding, and constipation. And the factors for this disease is girls experience period at a young age, and older women will menopause at a later age. And the treatment for this disease is through birth control pills, surgery, and uterine artery embolization. Next is ovarian cysts. It is a solid or fluid-filled pockets that are benign, non-cancerous, that can be found inside ovary. The symptom is pelvic heaviness, abdominal pain, and irregular cycles. The factor is hormonal imbalance, follicle issue, and endometriosis. And the treatment for ovarian cysts is by monitoring session within months or weeks and through surgery.
Next, we have uterine cancer. What is uterine cancer? Uterine cancer includes two types of cancer: endometrial cancer, which is more common, and uterine sarcoma, which is rare. Uterine cancer symptoms include bleeding between periods or after menopause. Treatment often consistent to hysterectomy to remove your uterus. And then, what is endometrial cancer? This is endometrial cancer. Developed in the endometrium, the inner lining of your uterus, is one of the most common gynecologic cancer, which is cancer affecting your reproductive system. And what is uterine sarcoma? It develops in the myometrium, the muscle wall of your uterus, or uterine sarcomas are very rare. So uterine sarcoma ni memang sangat-sangat rare, so jarang berlaku berbanding dengan endometrial cancer. Okay, what are symptoms for uterine cancer? The symptom is vaginal bleeding between periods before menopause, vaginal bleeding or spotting after menopause, even a slight amount, lower abdominal pain or cramp in your pelvis just below your belly. For the factor, obesity, age, high estrogen level, genetic and family history. For the treatment, irradiation therapy to the pelvis estrogen replacement therapy. And then benign prostatic hyperplasia. What is benign prostatic hyperplasia? Benign prostatic hyperplasia or BPH is a health issue that becomes more common with age. It's also called an enlarged prostate. That prostate is a small gland that helps make semen. It's found just below the bladder and it often gets bigger as you get older. And enlarged prostates can cause symptoms that may bother you, such as blocking the flow of urine out of the bladder. It also can cause bladder, urinary tract or kidney problems. So this is the, you can see. Okay, for the symptoms, frequent or urgent needs to pee, also called urination. Peeing more often at night, trouble starting to pee, weak urine stream or stream that stops and starts. For the factor, age, family history, lifestyle and metabolic factor. For the treatment, lifestyle change, minimal invasive treatment, MIST, and surgical treatments.
Now I will explain ovarian disease, endometriosis. Endometriosis serum or endometriosis is a chronic, often painful disease where a tissue similar to the lining of the uterus, endometrium, grows outside the uterus, typically on pelvic organ like uterus and fallopian tubes. As you can see right here, we have some trauma in the fallopian tube and in the endometrium right here. This misplaced tissue acts like uterine tissue, thickening and bleeding during menstruation. The factor, it is actually, the cause is unknown, but sometimes it is caused by hormonal imbalance and immune system issue. The symptoms can be bowel movement, pain during sexual intercourse, chronic pelvis pain, and progressive dysmenorrhea. For the treatment, hormonal therapy, sometimes surgery, and medication like pain relievers. For the oligosperma or low sperm count is a male fertility condition characterized by fewer than 15 million sperm per liter. Often asymptomatic, it is commonly identified when trying to conceive. The factor is ejaculation problems, hormone imbalance, lifestyle factors like smoking, alcohol drinking, obesity, and stress. The symptoms mainly infertility caused by 1 year of irregular unprotected intercourse, testicular pain and swelling, erectile dysfunction. Many of these don't have any obvious symptoms. For the treatment, you need to make some lifestyle changes, medication, and surgery. That's all from us. Thank you. Do anybody have a question?
Hari pagi ni kan?
Yeah.
Saya tak tahu orang. Boleh ke saya nak tanya secara summary je untuk yang penyakit tu? Boleh beri slide sebelum ni tak? Lagi yang first punya penyakit. Bolehlah sebelum kita ada dua uterine dengan ni yang ni uterine dengan ovarian cyst. Saya sebelum tu yang kalau uterine fibroids ni maksudnya dia nak secara ringkas dia penyakit macam mana?
Dia penyakit yang fibroids, dia ketumbuhan dalam kita punya
Uterus.
iya, tapi dia bukan dalam uterus dia, tapi dia boleh tumbuh dekat luar atau dalam uterus.
Okey. Kalau ovarian cyst,
Ovarian cyst tu dia dalam ovary.
ovary. Okey. Next. Kalau uterine cancer lah, okey saya faham. So lagi. Kalau yang ni,
Kalau yang ni dia actually untuk lelaki. Biasanya dia most men over 70, maknanya umur starting 60. Basically lelaki yang umur 60 ke atas akan dapat penyakit ini. Dia sebenarnya bukan kanser. Dia cuma masalah kesihatan yang common berlaku dekat lelaki yang dah berumur. Jadi dia masalah untuk buang air kecil. Jadi dia bukan kanser.
So masalah dia payah.
Baik kecil and then ada ya. Tapi dia bukan kanser. And then selalunya lelaki yang berumur 50-60 tahun akan terjadi benda ni.
Dia ada mention juga prostatik, maksudnya dia akan berlaku dekat prostat punya gland.
Ya, betul.
So next punya disorder endometriosis ni dekat endometrium lah kan?
Ya. Tapi tak semestinya dekat endometrium saja, dia boleh macam dekat sini fallopian tube kita boleh nampak trauma.
Okey, faham. Yang ni dia maksudnya ada inflammation ke ataupun dia ada cyst ni?
Dia macam it's more like a cyst, not inflammation.
Okey, so ada lagi disease.
Yang ni simply kita boleh cakap lelaki tu tak subur lah, secara kasar lah.
Dia still lagi boleh hasilkan sperma, right?
Ya boleh, tapi di bawah 15
Dia tak banyak nak
15 mil.
Okey. Dia punya sebab dia